Hello, everyone. It is 9 p.m. Welcome to the last episode of our Purple Room Empowering Women series, Women in Health. It's 9 p.m., so I'm sure everyone here has had their dinner. For our Muslim friends joining us, selamat berbuka puasa. I hope everyone has had a good day and a good meal, of course, at the end of the day, And like I mentioned earlier, this is our last episode, and I would like to remind everyone what our series is really about. The Empowering Women series is in conjunction with the International Women's Day 2023, and we came up with the show, WEA came up with the show to serve as an outlet for both professionals and the everyday woman to come together to discuss our challenges, our successes, our experiences. We hope that by listening and gaining this knowledge that the experts that we bring on can give us, it can help us kind of encounter and face the complex issues that we as women face. Thank you, Haslina. Our theme for this year was embrace equity, and while we still are agreeing that equality triumphs everything, that does not put aside the unique challenges that we women face, and that is what this show wanted to kind of address and also help fix in a way. Help us, give us the tools that we have to encounter these kind of problems. Yeah, so why? Well, even if these problems don't directly affect you, maybe you don't have these specific relationship issues, maybe you're not a mother yet, you don't have 5 children at home to take care of, but we are the change makers of this generation, and even if we are not directly in this situation, we can still help someone who is. We can empower other people who are in these situations. We can always be part of the movement and of the change. Now, women in health, a topic that is so important but is often overlooked. And for this, we are inviting on Nur Syafa Adina, a pharmacist with 8 years of experience, who is part of a branch of pharmacies, and she actually manages the one in Port Klang. Yeah, she's been working a lot with women over the years, and we're very excited to hear what she has for us today. Welcome, everyone. Nur Syafa, take it away.
Hi. Good evening, everyone. First and foremost, I would like to extend my gratitude heart to Women for Equality Association for inviting me tonight. And as Rina mentioned, my name is Nur Syafa and I am a pharmacist. I have 8 years of experience in the community pharmacies, and over the past years, I have been directly involved with the B40 communities in Port Klang, serving and caring for their healthcare needs.
Why would you say that your target or the people that you kind of work with are mainly B40 women?
Okay, the reason why I stress on the word B40 communities is because one, we are situated in the suburban area in Port Klang, and another one is because we often do collaboration with the pejabat adun in Port Klang as well. So oftentimes we do support for their healthcare needs, and also we do help in terms of their supplements and medications as well. That is why I stress on the words of B40 communities.
For those who are lay people, what is pejabat adun you were mentioning earlier? Is it a government body or?
Yes, yes, it's a government body actually under Selangor government. So like we have parliaments, MPs part of parliament office. So this pejabat adun is actually situated in certain town or cities, small cities. So they are the one that help these B40 communities to gain access to healthcare.
Okay, so the health industry, I have to say that it is not something that is the easiest to grasp as someone who is part of the general public. So we were wondering, in your field and in your experience, what is a common issue that most women encounter?
Okay, whenever we talk about women and health, sexual health will always comes to our mind. And yes, in fact, it is an unavoidable topic. But today, instead of that, I want to focus more on the basic health issues surrounding women. When we go about the topic of basic health screening, 90% of female patients that came to my pharmacy actually has high blood pressure reading. So whenever we ask whether they have seen a doctor to get it diagnosed as hypertension, this woman seems to be like in denial state. They said they didn't get enough rest because they were taking care of someone, and perhaps they are a mother and are managing the household because their husbands are away for work. So according to them, they just need rest. So questions coming into my mind: how different is that workload of a housewife compared to that of a working man? And what about the fact that nowadays women were also working to support the family, and we always have to go back to take care of our family later in the day? And it's like working 24 hours a day without stop. So how much rest can they actually have if the routine just never stops? They were always worried about overspending on their medications and supplements as well. Something as simple as blood pressure reading when neglected actually can lead to many health problems, for example, heart disease. And according to cardiovascular disease registry in Malaysia in 2021, female patients have higher mortality rates for coronary syndrome rather than male patients. And isn't this like sounds very alarming to us, because women is actually at a very highest stake of mortality rate compared to a man. So why do these women couldn't get a proper basic health screening, proper monitoring compared to a man? Just because they're taking care of family, just because they're staying at home, we often neglect them. So that's one thing that is happening in our community at the moment, actually.
From our previous conversations, I hear you mention stuff like hypertension and blood pressure. Is that like a common health problem that women have?
Yes, hypertension and blood pressure is hypertension and heart disease is one of the most fatalities diseases that's happening in Malaysia, and a lot of women's having that. But a
Is it
lot of
because
them
of
as well
stress?
a lot of them as well is having undiagnosed condition of hypertension. Actually, during the earliest stage, if we can diagnose hypertension, we can save more lives, because often this undiagnosed hypertension leads to strokes, and this can cause death actually.
This is just for my own curiosity. But why are women at a higher risk of hypertension? Is there a reason or is it just a correlation?
Yes, because women are dealing with hormones. uh, Even if during, even if we're having mental stress, mental health issues also can lead to hypertension. So nowadays, the cases of mental health issues is alarming, especially to the B40 communities, because they are very vulnerable communities that are susceptible to financial struggles, domestic violences. So it is something that we have to look deeper into.
You mentioned financial struggles earlier, and I'm assuming this affects the type of healthcare they can afford. Are there allowances or any subsidies for these?
Okay, for actually, our government is very a good government, I would say, because in Malaysia we provide the best healthcare. In 2019, we were rated by uh, sorry, in 2019 we were rated by, I need to find, okay. we were rated by the world that we have the best healthcare facilities. Yes, they can actually go to any hospitals. We have subsidies for treatments of any diseases. But the issues with BB40 communities is one, they are far. They are situated quite far from the hospital and also the KKM facilities. And second, they don't want to waste their time going to the hospitals, going to the hospitals and having treatments, because in their mind, instead of going to hospitals queuing up hours, they can actually work more to gain more. That's why financial struggles really affected their health actually.
Yeah, exactly related to this question, actually. I mean, you to what you were saying, is it getting worse for the modern woman because of their lifestyle? We have a very hustle culture now. you
Yeah,
know,
because
it's
I do believe, yes, I do believe, because nowadays it's like women and men are competing with each other, right? We need to prove to the world that we are capable as men. So we tend to forget that we need to take care of our health as well. So because of the you know because of the global challenge that needs us to step up further, that's why we often thought, oh, it's okay. I'm just tired. I just need rest. That's why I
what
think,
you should can't just sleep off our problems. So much easier.
yes, we always thought that, oh, my BP is rising, so I just need rest and I just can sleep away. But it's not as easy as that. There's a lot of things that you need to consider: your lifestyle, your working style, your mental health issues. All of this
Yes.
actually lead to a better health.
Hmm. Um, Hasina asked what is hustle culture. Okay, okay. For the Gen Zs who are watching this, I could be getting this term wrong. Shafa, you could correct me as well if you're familiar with hustle culture. But it's very, nowadays, especially with the economy the way that it is and the current challenges we have, right now, it's very, making money is always on the top of our list, despite all the signs that we should probably take a break. So it's even though we should take a break, I can work more or I can do overtime. Or if I'm getting the money, it's worth it, at the end of the day. Yeah. So health gets overlooked, in my opinion, a lot during that. Mental and, of course, physical the most, but mental also. Hence the
Yeah.
hypertension. I think no,
Yes.
'cause- Hmm. Uh, Nashafa, would you like to address Hasina's comment?
What is a hustle culture? Is it that
Uh,
one?
oh no, no.
Or
She said with due respect, I think it's not because we want to show we are capable as men, but that women aren't. Sorry, that men aren't doing their part in helping out in the house.
I do agree with this one actually.
Hmm.
But one part is, since the man isn't helping, there's two situations, when we women, we want to step out into being up the par with men. But there's another part of us that whenever we go back home, we always reminded that we are the owner of the home, so we have to take care of the home. So yeah, I do think so as well, that we just don't want to show that we are capable, but the man in the house is not helping. They still thought that we are the one who should manage the house, not them, because men are often perceived as the one who's going out making money instead of women. So yes,
Hmm.
they are still stick with the stigma that women should do everything in the house, not them.
But right now, can most families survive that way? With only one person being the breadwinner. Especially if they have more than one child.
I don't think
Yeah.
we could, because
Yeah.
you know the global inflation is going on. Economy is, it's very challenging at the moment. People are
Yeah.
losing job left and right, so it's not possible for only one breadwinner of the family.
Mm. Before we move on to Risha's question, actually, I do want to ask something related to awareness and information. Is do you get a lot of when these women come and see you? Are there any like what is the craziest misinformation or misguided thinking? Because obviously, like she said, lack of awareness, right? And that goes across not just P40, but across the board. Really, people are quite uneducated. So, what is the most like misguided, uneducated thing that you have heard someone say?
Okay. Recently, I met with one patient, one cancer patient. She was still undergoing treatment from Institute Cancer Negara. And then she said that one of the misleading information that she gave me was she cannot take the milk that the IKN gave her because it's going to like make her cancer spreads more. So I asked her about who's the one giving you this kind of kind of information. Then she said some doctors online. So I was thinking, instead of hearing the doctors treating you, instead of hearing the advices that the doctors treating you give, why are you so keen on listening to a bogus doctors online? I asked her why did you met the doctor online. So she said, oh, because he was selling supplements for me, and he said that the supplements
Oh,
is
that's how it starts.
yes, and the supplement is very good in curing cancer. So I told her the cost for the milk that she got from IKN for free is actually 115 ringgit. If she was to bought it by herself, do she wants it to buy it by herself because it will cost around 1,500 per month? And she said, yeah, I can't afford that. So I was thinking, and then why are still, why are you still hearing this kind of misinformation instead of really ask your treating doctors? Uh,
Oh yeah, I
it's
wonder why she didn't just ask a doctor. Maybe she didn't want to
yes.
offend
I was wondering, is
Moholi.
our, because we have the best healthcare in Malaysia, in the world, not just in Malaysia. We have the best healthcare in the world. But why are you willing to hear some bogus doctors online? I was quite surprised during that part. So I
Yeah.
advise her to just keep to your treatment, keep listening to your doctors treating, not just some online doctors.
Yeah, Hasina's right. It is a conflict of interest. He just wants to sell his cancer supplements.
Yes.
Yeah. I feel like it's kind of popular online now also. Not now, like it's been a few years of how easy it is for people to just sell supplements. You know?
Yes, that's the tricky part, Irina. Because whenever we try to like suggest supplements for them in the pharmacy,
Mhm.
they always say, "Oh, we don't have money for that." But you are willing to buy some online supplements for 400 ringgit per month. So I was thinking, what have gone wrong? What have gone wrong? You can spend 400 online, but you don't want to spend some little penny inside my pharmacy. I was like, okay, I can't bring that.
Yeah. Mm. Okay. So, Resha's question: how would you go about bringing educational awareness to members of the B40 regarding government-approved medicines and non-government approved medicines?
Okay,
Non-government approved medicines. What are
yeah.
those?
I think this one is the Hoggus Bogus supplements online. I think. Okay, so this is our challenges actually. Right now, people can get access to internet anywhere. So a lot of people are taking this advantage. A lot of founders are taking of this advantage to sell things online without proper consultations, without giving proper guidelines to these people. So these vulnerable communities actually believe online more than healthcare professionals. Uh, in order to actually giving awareness to these B40 communities, actually we need to set up some team. I believe we do need to set up some team that really targeted approach to these B40 communities. We have a lot of B40 communities, just in not just in Selangor. I believe there's a lot of untouched B40 communities in Malaysia. So government really need to step up their game in penetrating these B40 communities.
What are current efforts usually done by health bodies to inform the public? Like, is it via posters? Like, how do they go about bringing this awareness?
I can say there's a lot of initiatives that has been done, but most of them are online. But personally, for me, giving awareness online doesn't really give the same results as when we go to them personally. So
Mm.
instead of giving awareness online, I wish that these governments do make use of the community pharmacies around to actually penetrate and touch these B40 communities. Maybe subsidize a program, for example, to touch these B40 communities.
Mm. So have programs for it. Do are
Yes.
these so these programs already exist, but we could utilize the pharmacies around, is it, to help
Yes,
educate?
because the bad thing about Malaysia at the moment is people don't really recognize pharmacies. Even though after so many educations going on, people still perceive us as people who wants to make money with our medications. So that's really heartbreaking for me personally, because as a pharmacist, we are also tied to the Hippocratic Oath, where we need to treat the sick based on one's ability. So whenever we are perceived as someone that wants to strip off money from a vulnerable group, that's really heartbreaking and sad. It's a
Mm.
mentality that we really should work on at the moment.
Yeah. Is this would you say this is a answer to the question that we are asking, which is what are the challenges in the pharmaceutical world for women pharmacists? Would you say that is a big challenge?
What are challenges in the pharmaceutical world for women pharmacists? Is it
Mm.
um, to say that there are because pharmaceutical world is a very big term. Pharmacies as well is actually divided into a few different sectors. We have hospital pharmacies, we have industrial pharmacies, and me in community pharmacies. So the challenges will be different in each field. So to say that women are greatly challenged by men in the pharmaceutical world, it's a bit hard for me to give a comment on that.
Mm. Because it's such a big industry, is it?
Yes, it's such a big industry and it's such a wide topic to talk about as well.
Mm. Okay. Um. So you were mentioning earlier that because of our busy lifestyles, usually we kind of overlook these health issues, and not health,
Mhm.
well, kind of our health issues, and also certain, maybe you would say, health assessments we should be getting. Because the one that's
Mhm.
pretty popular that people mention that we should be paying more attention to is breast exams.
Yeah. Yes.
Hmm.
Sorry. Breast cancers are the highest. Have the highest prevalence in Malaysia, but even though the statistic prove it like that, still the assessment of breast mammogram is very low among women in Malaysia.
Hmm.
So I'm not sure whether it's the awareness that's lacking, or is the access to these breast mammograms are lacking. As far as I concern, breast mammograms only need to be carried out in a hospital. So perhaps women are not able to make time for it, or women are still not knowledgeable on breast mammograms. So these are the part that we really need to take consideration into popularizing it, meaning give more awareness for people,
Yeah.
for women to go for the breast assessment.
Can it be done by ourselves? Do we just wait until there's a lump and then only one day we realize the lump is there? Like, do we just wait till then?
Actually, we can do our breast assessment by ourselves. But whenever you felt alarmed, even KKM has outlined a guideline where we can do self breast assessment. But the breast mammogram screening is something that you need to do at a hospital.
Hmm. So, where do you think this type of education should start? Because I'm wondering if high school is too early. Like, what age group would be the best to target to teach all these things to?
Well, yeah, Rina, you said mentioned about schools, right? Actually, there's a lot of health programs in school, but right now I think we need to touch more on the university and working part, because a lot of women who's working don't have the uh, accessibility
Hmm.
to these health screenings. So I was thinking maybe our government can subsidize the companies itself to encourage their women employees to go on for the assessment, for the health assessments. It will be good for them because we know a lot of women are working and a lot of them are at the higher rate of developing diseases. So it will be a good approach for the government to subsidize all these companies to encourage their women employees to go on the health screening assessments.
Yeah, I believe that like you said earlier, all these programs they do exist, and if I'm not mistaken, correct me if I'm wrong. There are like free assessments you can get, right? Can you get free assessments anywhere?
Yes, in the government facilities, actually you can get for free. But
Mm.
the thing is, with our healthcare system, uh, it will take up quite some time for them to commit, because even though we are improving on that part, but still it will take some time of their time. So not a lot of women has this privilege on having leave just for doing health assessments. So
Mm.
if that is enforced by the government to these employers, I bet a lot of women can have better healthcare assessments.
Yeah, that is a very good insight and good point. We talk a lot about governmental change, but to bring the scope down, to
Yes.
we can push for that too. But you were mentioning, we view going to hospitals as like whole day trip, it's long and stuff, so we avoid doing it and then we put it off, and like we're mentioning hustle culture, we just go on with our life until there is something that tells us, that kind of forces us to like take a break, you know what I mean? So
Yeah.
maybe there are ways that we can monitor our own health before it gets to that point,
Mm-hmm.
yeah,
True,
before it
true.
gets to a point where your body is like, stop, sit down, yeah. Before we get to that point, there has to be something we can do for ourselves. And which brings us, thank you, Shafa, for all this information and knowledge. Like, as that's the general public, even myself, I'm not aware of a lot of these things. And as
No
someone who's
problem.
young, I'm like, oh, I have so many years until I have to deal with things, you know what I mean? My health is great, strong as a horse, metabolism amazing, but we have to take these steps from now, just in case. And
That's
that
right.
brings
That's right.
us to our surprise that we have for our guests. I will let Shafa explain it to everyone. Can the moderator? Yes, thank you. Shafa, can you take it away?
Okay. So on 24th of June, from 10 a.m. until 12 p.m., I will be conducting a workshop actually. So the workshop title for my workshop would be how to take charge of your health. So the benefits that the public would get from this workshop is knowing the important parameter to maintain your healthy life, and also how to choose supplements that suits your health conditions. With the arises of many online products online supplement products online, a lot of people will be confused on how to actually choose the best supplements for them. So this is one of the benefits that public would get to know from my workshop on this 24th of June.
Yes, thank you. Just for everyone's information, the date may be subject to change, but on WA social media, we will definitely update everyone. And to join, we accept donations as registration fees. Yes, thank you so much, Shafa, for being the
Thank you, Rina
final
and
guest on
Abby.
our series. A very important area to pay attention to, guys. How can we fight for change if our bodies are not healthy? Thank you so much, Shafa. Thank you,
No
everyone, for
problem. Thank
watching.
you.
Bye.
See you. Bye.